Acid suppressive medications are increasingly prescribed for hospitalized patients, although the incidence of nosocomial GI bleeding and the magnitude of potential benefit from this practice are unknown. We in cardiology are particularly aware of this issue because of the potential interaction of some acid suppressants and clopidogrel. Now in the Archives of Internal Medicine, there is a report on the incidence of nosocomial GI bleeding outside of the intensive care unit and the association between acid suppressive medication use and this complication of GI bleeding. The researchers looked at the use of a proton pump inhibitor or histamine 2 receptor antagonist in patients admitted for diagnoses, of course, other than GI bleeding, and then measured the incidence of subsequent nosocomial GI bleeding. This was a big study, including more than 78,000 patients. After matching on the propensity score, the adjusted odds ratio for nosocomial GI bleeding in the group given acid suppressive medication relative to the untreated group was 0.3, but the number needed to prevent one episode of nosocomial GI bleeding was 770. Well, the conclusion seems clear. Nosocomial GI bleeding outside of the intensive care unit is a rare phenomenon. The number of patients needed to treat and prevent one case of nosocomial GI bleeding is high, supporting the recommendation against routine use of prophylactic acid suppressive medication in non-critically ill hospitalized patients. I'm Peter Block, and this is a CardioSource Heart Minute.